We'll look about tooth discoloration for knowing better about bleaching in the next video. So before knowing about the discolorations, we should know about the normal color. In primary teeth, the normal color is usually bluish white. In permanent teeth, it may be grayish yellow, grayish white, or yellowish white. And in elderly persons, it is more yellow or grayish yellow. So coming to tooth discolorations, tooth discoloration can either be extrinsic or intrinsic. Extrinsic tooth discoloration, the most common is tobacco stains, followed by Nesmith membrane. Nesmith membrane that is seen in primary teeth. It is a green extrinsic discoloration due to the presence of reduced enamel epithelium on the erupted teeth. This can be removed during mastication and following scaling. So the mode of attachment of stain in extrinsic tooth discoloration can be due to long range interactions or short range interactions. Long range interactions include electrostatic interactions and van der Waals forces, and short range interactions include hydrogen bonds, hydration forces, or hydrophilic interactions. In extrinsic tooth discoloration, it is due to the presence of chromogenic material within the enamel and dentin or dentin. So the most common pre-eruptive intrinsic stain is due to endemic fluorosis, followed by tetracycline stains. So tetracycline interacts with the hydroxyapatite crystals during mineralization of the tooth, thus causes stains. During developmental stages, amelogenesis imperfecta or dentinogenesis imperfecta can cause intrinsic stains. So NATES in 1997 gave the classification of extrinsic tooth discoloration. He classified tooth discoloration into three types: N1, N2 and N3 types. N1 and N2 types are direct dental stains, and N3 type is indirect dental stain. So N1 type is due to a chromogen, that is colored material, that binds to the tooth surface and causes discoloration. Here the color of dental stain is same as the color of chromogen. In N2 type, the chromogen changes color after binding to the tooth surface. That is, the color of stain is not the same as the color of chromogen. In N3 type or indirect dental stain, colorless material or pre-chromogen binds to the tooth surface, undergoes chemical reaction and causes stain. So if extrinsic tooth discoloration classification was given by NATES, it is of three types. Coming on to general classification of tooth discoloration given by Abbott in 1997. He gave the classification as cause and its color. Here there are four types of discolorations: extrinsic discoloration, extrinsic and intrinsic discoloration, intrinsic discoloration, and discolorations due to iatrogenic cause. So coming on to extrinsic discoloration, the first cause may be due to cigarette, cigar, pipes, tobacco chewing or marijuana. These causes cause discoloration in the color of yellowish brown, black, or dark brown to black rings. So if these colors are noticed, it might be due to these causes, that is cigarette, cigar, pipes, tobacco chewing. So coming on to the next cause, tea, coffee or other food related extrinsic discoloration. It causes brown to black stains, and due to poor oral hygiene, yellow or brown shades of discoloration may be seen. In case of extrinsic and intrinsic discoloration, it might be due to fluorosis and aging. It leads to white, yellow, brown, grey or black discolorations. The next type of discoloration is intrinsic discoloration. It might be due to various causes. The first one being genetic conditions like amelogenesis imperfecta and dentinogenesis imperfecta. In amelogenesis imperfecta, the teeth appear brown, black, and in dentinogenesis imperfecta, the teeth appear brown, blue. In cases of systemic conditions like jaundice and porphyria, the color may change to blue-green, brown, or purple-brown. In cases of medications taken during tooth development, like tetracycline and fluoride, the color of tooth may change to brown, grey, or black. In cases of tetracycline discoloration, bleaching is usually difficult to carry out, as the stains are more severe in case of tetracycline tetracycline as compared to stains due to fluorosis or excessive fluoride ingestion. Next, due to body byproducts like bilirubin and hemoglobin. In case of bilirubin, the teeth color changes to blue, green or brown, and in case of hemoglobin, it may turn grey or black. And due to pulpal changes like pulp canal obliteration, the teeth usually appears yellow. And in case of pulp necrosis with hemorrhage, if there is pulpal necrosis with hemorrhage, the teeth may turn grey, black, and without hemorrhage, the teeth may be yellow, grey, brown. Next cause is due to iatrogenic causes. In iatrogenic causes, the first reason may be trauma during pulp extirpation, where there might be presence of vital pulp near the apices, so it is an iatrogenic cause. It may cause grey or black tooth discoloration. Next, due to remnants in pulp chamber, this may cause brown, grey or black discolorations. Tissue remnants in pulp chamber may be due to inadequate shaping and cleaning of the tooth during root canal procedures. So even remnants can cause brown, grey or black stains. And due to restorative materials like amalgam, there may be brown, grey and black discolorations. And due to endodontic fillings, the teeth may appear grey or black. So in the next video, we'll watch in detail about bleaching.